Baumstein says it's important for parents to listen to what their children are thinking and feeling about the vaccine, and also to validate those feelings. Let them know that any feelings or of being confused or scared is okay, and it's also normal. Joining us now with the latest on the coronavirus pandemic is emergency medicine physician Dr. Hilary Fairbrother. Dr. Fairbrother, welcome to BNC Live. It's a pleasure to have you. So, what about the potential risk of this vaccine? I know I heard of myocarditis. What else are kids at risk of?
So we have seen a very small percentage of young people get myocarditis. It's typically after the second shot, and it's men or male patients more than female patients. This is a very low risk. I want to just repeat that. It's very low risk. In fact, you have a much higher risk of getting myocarditis from getting COVID than you do from getting it from the vaccine. But nothing is no risk, and so this is the risk that we've seen associated with this vaccine. Now, of note, Pfizer, in their preliminary data in thousands of children in the 5 to 11 age range, have noticed no cases of myocarditis. So we are really hopeful that there are actually no reported side effects, serious side effects for the 5 to 11-year-old children. And so I know, I'm a parent, it's really hard when you're trying to make the decision of whether to vaccinate your children, what the risks are, and what the possible benefits are to your children. But the FDA has decided unanimously, 17 votes to 0, that this is a safe vaccine to offer to the 5 to 11-year-old children in our country. And that's a really rigorous process that they have to go through to grant that EUA approval of the vaccine to these children.
So where do
So
you
it's now
fall?
available.
Where do you fall in the group of parents where some are saying, hey, I'm going to have my child lined up and ready to get a shot? And then there's another side of the coin where some folks are saying, I'm going to wait.
I'm going to get my kids lined up for the shot. As soon as they are eligible, I will make sure that my children are vaccinated. You know, I work in the emergency department, and I see the children who are really severely affected by COVID, whether it's severe enough to be hospitalized and very sick and almost dying, if not dying of this disease. And that's rare, but it's awful to see. And if that's preventable, I want to give my kids the chance to not have to deal with that disease. Also, I see a lot of kids with long-term COVID symptoms. So kids that used to be athletes who can't practice anymore because they get too short of breath, or they can't run around and play the sports that they used to like to do. Kids whose lives have been really changed by having this infection. And I don't want that to happen to any more children, and I don't want it to happen to my children.
Dr.
So I'll be
Fairbrother,
getting my children vaccinated.
let's back up because I think we've been in this pandemic for so long. And the original message was kids are safe, kids are fine. They're young, you get it, they'll bounce back. But as you just mentioned, you're seeing kids that are sick. Can you tell our audience what some of those symptoms are that you're actually seeing in these children?
Sure. So the number one symptom that I see in children with severe COVID is shortness of breath. That is above and beyond the number one symptom that really seems to make children really sick is their oxygen gets low and they feel shortness of breath. And that can last for quite some time. And that sensation of not being able to breathe, especially with walking or any kind of running around or exertion, is something that can last in patients and in children as well for many months. And that's that long COVID. So I think it's hard. The messaging in this pandemic has been really confusing, and it seems like every week somebody's talking about something different. In general, kids do not get really sick with this virus, but they can get sick. And as we've seen with the Delta variant, as millions of our children in the United States got sick, there were a certain percentage of them, a very low one, but a certain percentage of them who got very sick, and a certain percentage of them who dealt with long-term symptoms. Even after they were no longer acutely sick with COVID, they were still dealing with some symptoms. And again, the most common one being shortness of breath.
Yeah, it's just heartbreaking. Just the thought of seeing a child gasping for air makes my heart break. We actually got a wrap, but I got one more question for you if you could answer it quickly. Delta Plus, as an emergency room physician, are you concerned about this? It's popping up on the in the UK could come here, could already be here.
I was going to say it probably already is here. What we've seen with the variants is by the time we've named them and we've started thinking about them, they are already here. We live in a world that doesn't have borders in the way that we used to. And it is likely that it's already here. I think we're worried. Everybody here is worried. I would tell people to keep doing your safe practices like masking and social distancing and good hand washing, and get vaccinated as soon as you're eligible. Get your kids vaccinated as soon as they're eligible. And we don't know what's coming down the pipeline, and we want to protect as many people as possible. And we know that the best way to do that is to get people vaccinated, even if they've already had coronavirus.
Yes.
Get vaccinated.
Thank you for adding that. I had it, and I'm also vaccinated, and I'm waiting on my booster. But you're right. Hopefully the pipeline does not include another surge, especially as we enter the holiday season. Dr. Fairbrother, thank you so much for joining us. And things are getting crude on Capitol Hill today as Congress calls for the big four oil companies on the carpet. Time to speak up. Coming up, Democrats say the companies have